Good afternoon, everyone, and welcome to this week's Tools for Frontline Staff Poverty Reduction session. And today we're joined by myself, Abby Hover, and Charlie Clark, and we're going to share about the work we've been doing around system convening here in Hackney Council. So Charlie, without further ado, I'll hand over to you. Oh, one thing to say before Charlie jumps in. You see Hannah's name there. Many of you know Hannah. You've seen her around probably on meetings or in spaces. She is one of our system conveners, and apologies, she cannot be here with us today, but know that she's here in spirit with this presentation.
Thank you, Abby. So system convening. You might be thinking, and no one would blame you, what is system convening? Which is completely fair enough. Or you might be thinking, yeah, I've heard about that, but I didn't know we had it in Hackney. And if this is the case, I apologize. You've been in a meeting with me before and are sick of hearing about it. Some of you have heard this presentation already today. So, I'm sure you'll be ready to talk about system convening. Whatever the case, we wanted to use this time today to tell you a little bit about system convening, what it is, what it has meant in Hackney, and what we hope it can be for the future. Rather than trying to focus on all the specific bits, what we'd hope for you today is to think about what here feels familiar in the way that you work, what do you recognize, and what here feels different and makes you curious.
So to start with, who are we as a small team? We've got two system conveners, Charlie and Hannah, and their brief is to be out on the ground and get into community settings in council and health spaces, make connections, build understanding, and support work to be set up. They both bring backgrounds of frontline experience, Charlie as a housing officer, and Hannah been a former social prescriber, and she's worked in the VCS directly with Mind. And then I support both of them, trained to be a bit of that practical and operational support, but linking into some of the council's strategic priorities and opportunities as well. And our roles sit within a new council directorate or service called Strategies, Equalities, and Community Partnerships. And it's in the central chief executives directorate of the council. And many of you have worked with us for a long time, and we've worked in the Tackling Poverty and Inequality team that is reshaped now, but we've been really guided in large part by the council's poverty reduction framework. We also know we're not alone, so our broader service works in many of the ways that we do. Many of our colleagues have been system conveners right alongside us. And we also know that many of you do this sort of relational systems thinking, systems approach to work as well.
As Abby mentioned, my background was largely been in housing services prior to this role. And while I was there, I did my best to support the residents on the estates that I managed, and trying to manage complex cases. I tried to bring in the other teams that were there that I was aware of. And when I was supporting a resident, I tried to signpost them to the relevant support. However, it wasn't until I stepped out of that role and was able to explore complex issues from a different vantage point that I got a sense of how rich the offer of support is in Hackney, but equally how hard it is to connect it all together. I didn't know, for example, that on the estate I managed, there was a GP practice right in the middle of that estate. And in that GP practice, you could access a lot of support around being socially isolated. There was a weekly coffee morning. Or that a bit further down the road, there was an organisation that provided a free 3-course lunch one day a week and a dinner another day a week, and brought in other support from organisations like Turning Point. Sometimes they had a hairdresser to support those residents in real financial need. Or that even 10 minutes the other way, there was an organisation specialising in supporting Turkish and Kurdish communities, which would have been really helpful in my work as a housing officer, but I had no idea they were there. I think it took me a long time to stop feeding in the traffic jam of the work and to start to look at how all the roads fitted together. And I think that's what system convening is. It's about thinking about those roads, and that's been a process of learning and unlearning. And it was striking, when we first started these roles, how few spaces there were to come together and learn and to connect and think about how to ease the jam. This has been one of those spaces over the years. of like, how do we think collaboratively together? I know that Anna too, she started system convening from different kind of perspective, having worked in the VCS and in health systems. And it took her a long time to learn how local authorities work and how they think about work, which has been a really steep learning curve. I guess all of this is to kind of say, you don't start this sort of system role by having a deep understanding of what's going on or loads of connections with the borough in the borough, but it takes time to kind of build that learning and understanding and kind of be in networks. And I think now, after a lot of that time, we have real experience of trying to deliver work in complexity and operating in the spaces in between existing service offers.
So that's really helpful in terms of who's behind this work, but what does it actually mean? So a bit of a definition: system convening can be described as an approach to work that centers trying to create sustainable change across challenging silos in complex social landscapes and amid changing circumstances. I think something we're probably all seeing in our work daily, if not weekly. For us, it's meant being in community, listening to those on the front line with residents, trying to build meaningful relationships, understanding what is being experienced, and then trying to find ways to change the way we're organized to support residents in Hackney. And we're particularly thinking about those whose lives don't fit neatly into the systems we've created. And we really see our work as values driven, in particular, trying to champion those three things you see on the right-hand side there: putting people first, sharing knowledge and power, and adapting and learning from each other. We also see it, and I know this is a lot of words here, but that we see it about bringing people together to tackle complex challenges, but also embracing that complexity and thinking, how can we reimagine boundaries? It's been about creating conditions for change and maybe even bringing in some innovative thinking across, from wherever it exists in the system. It's been about seeking to understand who is around the space. And it's rooted in really learning and curiosity, and then creativity and also practicality. And it can be a lot of different things. So if you've worked with Charlie, Hannah, any of the team that's working in this way, some of the ways it has been is actually creating spaces and calling people in, that convening, like literal convening. Sometimes it's been the co-producing of shaping things and creating things together. Sometimes it's been a bit of the clarifier, so making sense of things that maybe may not make initial sense for residents. Capability building or coaching, whether it's like helping support people to grow in their own capabilities or just being there to support, strengthen, mentor. It's really about connecting. I think this is something like Charlie is brilliant at, for instance, and we see that after these tool sessions, if it comes up that someone might be, really benefited by connecting with another person, he's right on the email, directly connecting them, making those warm introductions. Sometimes it's about choreographing. It's that kind of that dance of bringing people together and figuring out what does work for them. But really, if we're doing all of this the way that we hope we are, it's being the community builders where we're strengthening those shared purposes and strengthening this sense of us supporting residents. And then I suppose you're probably looking at those and thinking, I do a lot of that. And we absolutely see some co-conspirators or, others doing a lot of this work as well. Today, we wanted to share about what Latitude, being system conveners by title, has allowed us and the work we've been able to do in the space under that banner. But we know that others work in this way across Hackney, in the council, in the VCS, in health, and all those groups that make up the borough.
The first thing to acknowledge in all of this is the system is complex. It's complex for those working inside of it, which is why we've created spaces like this to help navigate it. And it can be even more complex for residents trying to navigate it. And to better support residents to access those services that they need, there is a need for those services helping residents to work differently together. And working together differently and collaboratively is really hard, but it often starts with a conversation and a jump into that unknown and that uncertainty. System convening has been a jump into that unknown. In September 2022, nearly over 3 years ago, 2 system conveners were recruited from frontline posts within the council and were tasked with trying to create and utilize spaces that help people to learn, that prioritize building relationships, and sought to strengthen the trust between different organizations across Hackney.
It was quite a big task for 2 people, and still is for 2 people, which is why it was started by rolling up their sleeves, going out to build understanding by having conversations with organizations, and those organizations specifically who are working on the ground with residents in person-centered ways and really trying to tackle the inequality and hardship that they're seeing. It was conversations with council teams looking to deliver services a bit differently or engage with communities in new ways. And especially early on, we knew couldn't just go into rooms and convene without understanding those component parts, like the existing relationships, perspectives, motivations, pressures, realities and headaches and everything else people might be facing. And something that's remained really central has been building an understanding, or I think in what a lot of spaces is called mapping. So it's involved literal mapping, like you see here, building our understanding of who is where, doing what, next to whom, on what geographical footprint, around which estates, around which neighborhoods, those sort of perspectives. But it's also involved sort of mapping and understanding connections, like you see on the right there. I'm sorry, it's really small. It was more just for the visual idea. This is a very early connection map, and it involved building that kind of understanding of who the partners were, how they're connected to the different people around them or the different services, what they might care about. And what we regularly heard in those early conversations and mapping is that people are tired of being mapped, and in these individual ways that kind of happen maybe with different council departments or services, with different projects coming up. So we've also tried to build these sorts of continuous understandings that maybe we can draw upon and share, rather than having them live in our heads or having different teams recreate this always from scratch. And from that work, we and the teams around us really tried to have done a lot of things, and the work has taken quite a few different shapes. So some of the initiatives we've supported, some we've led. We've tried to bring that sort of same values-driven approach to the work that's really starting with conversation, seeking to understand, building a common shared purpose, and understanding the issue from multiple perspectives. Some of the issues we've spent time on have been co-locating services, especially in community spaces, improving our communication around crisis, directly trying to support food and fuel poverty, working around health inequalities for families living in temporary accommodation, hoarding, place-based working, I think the list goes on. And because we've responded to need where it arises, and because our work's personal, rooted in connection, we're trying to listen to those of you on the ground and what you're experiencing and responding to that. The way we've approached all of these has been very different.
And there's been a lot of uncertainty in that work. And when we've been trying to address these complex issues, we haven't always known where the conversations we've had will lead, but we've trusted that relationships are the route to that learning and change. I can see Natalie Pink's on the call, and Natalie reached out to us about a piece of convening which is represented here. It's come from all different sources, that sort of work and approaches. And that work has looked really different. We found, between Hannah and myself, different ways to be system conveners. Hannah's work has mostly focused on one particular knotty issue, whereas my approach has been broader, focusing on connecting different threads together. One such thread is how energy advice is delivered in the borough. In early 2024, an external organisation approached the council with additional capacity to deliver advice to residents, but they didn't have the relationship with local organisations to go out and deliver the work alongside them. And we'd been hearing from, in other spaces, that organizations that were working with residents to tackle food insecurity, for example, were hearing just how much residents were struggling with the rising cost of living, particularly around utility bills. So there was an opportunity to kind of bring those two things together. So alongside Marcella Lite and Hackney Light and Power, we rolled that offer into other forms of co-location we've been working on and used our relationship and knowledge of the system of support to hit the ground running and start to facilitate connections. And since November 2024, with that work, we've had 2,687 different engagements with residents around fuel poverty in partnership with 60 organizations in 107 different locations. The vast majority of those have been partnership with the VCS. So we've then gone to local community food shops, lunch clubs, coffee mornings, more. And while the numbers in the data help us shape that work and help us identify the gaps in provision, who we're not reaching, where we could go in the future, it's our relationship with partners that have allowed us to really build on that learning and to adjust our approaches to best meet the needs of the residents accessing that support. And it's important to say this work is rarely static. Things don't stand still very often in Hackney. So while our initial involvement in this work was about getting the offer in front of those who would benefit most through that kind of direct connection and facilitation, that work is now morphed into how do we build a system of support around fuel poverty that allows for collaboration between different energy advice providers, that creates clear referral pathways into different streams, and is part of an accessible and visible system of support. This work is ongoing. I've got more meetings about this tomorrow. I know Emma's on the call. I'll probably be speaking to her about this soon too. This kind of thing doesn't stop. Hannah's work has looked very different to mine and has been really working in real depth around one particular issue. In response to an evidence review commissioned by Public Health into the long-term health outcomes for families in temporary accommodation, coupled with the then Assistant Director of Benefits and Homeless Prevention forming a cross-sector strategic group to consider the needs of those families, Hannah was tasked with exploring this issue from all sides. In that instance, the catalyst for change and action came internally, and system convening was deployed as a resource to provide additional capacity to work relationally with different stakeholders to understand the systems as it was on the ground, and then through testing and learning, bring together a program of support. And that has been really detailed and intense work that Hannah's been up to. She conducted nearly 50 interviews and visits around this issue, speaking to voluntary sector organizations working in that space, hostel managers, primary and secondary care kind of colleagues, as well as the parents themselves living in the hostel, identifying the barriers that made collaboration difficult. And because that approach was slow and careful and thoughtful, from those conversations, a group emerged, and with no additional funding, they set about co-designing a multi-agency drop-in with 5 non-negotiable principles. The first of which was trust first, putting people over processes. Secondly, being anti-racist and trauma-informed. Thirdly, bringing the VCS, council and health partners into one room to have conversations around these issues. And then being community-led, meeting families where they are in trusted spaces, not just in council buildings. And then being adaptive, starting small, listening to feedback and changing the model where appropriate. And that multi-agency drop-in is still going. And we can share some more details in our Poverty Direction newsletter about what that's going forward in the future. And from that work, other ideas have emerged as well. And Hannah provided leadership and coordination in a really complex area that required curiosity, cross-sector collaboration, and collective sense-making, and is one of our kind of main examples of how to be a good system convener.
And beyond those 2 examples of what work has looked like, the system conveners have also been a really important resource for the council internally, specifically for our VCS grants program. So we've supported the 3-year community infrastructure grant program that just came to an end, which within that core funded grant program, we were working collectively with a group of organizations. Again, sorry for the visuals here. You're not meant to be able to read all of the specifics. Again, it's this idea of what's the shape of this work, what's it kind of looked like at a macro zoomed out level. But it was really organizations working around 3 different aims. So meeting holistic needs of residents, residents and their families, building trusted relationships that are strengths-based, person-centered. The second one was developing and prioritizing partnership and collaboration across different services, health, council, VCS, sharing learning, sharing resources. And then the third aim of that grant program was all about relationships of trust. So organizations who had trusted relationships with communities furthest away from statutory and council services, and organizations who were consistent advocates for those residents to enable access to services for them. So the support we were able to give to this program was different from a more traditional grants management approach. The conveners really brought the capacity to bring a relational engagement and relational approach. So even on that, we tested having relational leads where each organization was directly connected with a named officer in the council. I don't know if we have any of those on the call today, but trying to create, break down some of the barriers that existed with even access to different council teams and services. We also arranged a shadowing day at one point throughout the program where the Here to Help team opened their doors for a day and had a few organizations come sit with them, join meetings, get to sit next to Here to Help colleagues. And that really led to some of the most successful Here to Help outreach sessions. And it built real understanding across both sides of what are the pressures being faced by the VCS, what are the pressures being faced by the Here to Help team, and building some of that understanding and empathy. And then we also convene spaces of all of the grant-funded organizations in this program to regularly bring them together so that they could share how they're supporting residents, how they were trying to work through challenges, what challenges were actually coming up. And then we saw a lot of collaboration spin off of that was happening then outside of the grant program, which led to us testing some new ways of reporting around a grant-funded program, where we experimented with and tested out some video and interview type of reporting, and conducted some ripple effect mapping as part of the reporting, where we brought all of the organizations together to make sense of what the collective impact and learning had been throughout that multi-year grant program, which is very different maybe from how a traditional or some grant programs work. We also thought it would be helpful to share, how did we make these roles possible, since they are somewhat different to how some council roles work. And it really initially was conceived of by Claire Whitney and Jenny Zenow. Many of you probably know those two women. They did a lot of work during the pandemic and a lot of learning during the pandemic about how the way we're currently designed as a council is not fit for purpose in our current complex world. And we really needed to work differently in the face of these challenges that we'll continue to face and that are just growing for the residents. So they really advocated for piloting something different, and they were advocating on the inside for what the risk to residents would be if we don't work differently. So to do that, they really pulled on some of the funding we had available under the poverty reduction budget, again, associated with that poverty reduction framework. And then we had support from public health, who believed in the way we were trying to work as well. And we saw an opportunity within the Household Support Fund to continue these roles, to continue that joined up support and the work we're trying to do. And then moving forward, from April 1st, the roles are going to continue under the Crisis and Resilience Fund, where the focus will be aligned with a couple of the higher level outcomes with that fund. One of them around improving individuals' financial resilience, so that our residents are better able to weather financial shocks, or we can maybe prevent the recurrence or escalation of crises. And then the other outcome that I'd argue we've already been trying to work really hard around, but we want to really strengthen that joined up, visible local support network that's really key to building financial resilience for people. Alongside the Crisis and Resilience Fund, we've been working across the council with teams like in transformation in the neighborhoods work, our children and families team, public health, benefits, homelessness prevention, climate, employment and skills, education, housing, and really trying to open those service areas up to VCS and health colleagues, again, crossing these boundaries, bringing people together, adding relational capacity so that we can shift the system where it needs to shift. And these are, yes, directly aligned with our poverty reduction framework, but we've also argued that they spell out and they're walking the talk of the strategic plan, ways of working and fair ways, working for a fair Hackney. We're working closely to the transformation program in our target as a council. And they've been an integral part of developing our new council VCS strategy, especially through that support for the CI grant program, and really moving from strategy as something that's a plan and something that's on paper to a strategy that's being put into practice. So shifting from that static, predetermined approach to trying to be more fluid, dynamic, ongoing, strategically thinking and acting. So to put it another way, it's focusing on the how and the what of a strategy rather than just the what. And we're also trying to build out our small team to be a resource to the system, to enable others to be able to work in this sort of systems approach relational way, despite or amid the growing pressures and constraints that each team's facing.
So it's been really, so if you're interested in this work and you're feeling curious and want to connect with different parts of the system, you have ideas about things that can shift, you want to change the dynamic of the space you're working in, or have like a knotty issue that you want to explore the sides of, please reach out. Let's have a conversation about what that looks like. Our guiding light this year will be around how to enable a joined up, visible local network of support. But a lot of ideas can fit under that umbrella. So we're really kind of wanting to use this space and other direct conversations to really surface the work that's going to make the most impact for residents. We're funded for another year, at the moment, until March 2027. We're relying on other parts in the system to have that conversation with us about what's really going to matter and make the difference for residents. So if you've got ideas, let us know. And in effort of all of that, throughout our work, we've been proponents of the Peter Block School of Thought, which I'm sure if you know me at all, you're sick of hearing. We must establish a personal connection with each other, connection before content. Without relatedness, no work can occur. So if you don't know us very well and want to kind of have a conversation about that work, please reach out. If you do know us very well but have ideas, reach out. And we want to explore that with you either in this space and other spaces. So that's kind of the end of our presentation. I'll stop presenting. And does anyone have any questions? I know that some of you know us quite well, so it's a bit strange presenting about the work, but just put it out there.
Yeah, Maddie, come on in.
I'll break the ice with you. I guess I'd be interested to hear about like what a highlight of the work has been for you, just a personal highlight, and maybe when you felt like something's really shifted, because often it can feel like we're really pushing, but nothing kind of moves. So yeah, just be interested to hear what you think around that.
I mean, while Abby's thinking, I'll have a think. I think for me, there've been lots of highlights and there've been lots of different approaches. That's kind of where it's felt like we've put in lots of groundwork and then things have come together when we've brought people together. In particular, I think I'm really proud of the work on the community infrastructure grant, and because that was a long process that kind of existed throughout the whole 3 years of convening, and particularly how the kind of all of those conversations, all of that learning over 3 years then went on to feed the new VCS grants program and renewal. And I think particularly, feeling that like all of that learning, all of that input went somewhere useful, particularly through what we've also spoken about this space, the fair ways of working kind of visuals are in that presentation too. I think that culmination of that dialogue particularly felt quite, satisfying, and I'm glad didn't just stop.
Yeah, and I was just thinking about, I mean, I wish Hannah was here to talk a bit more about it, but the work that she and others have been doing in the space of supporting families in temporary accommodation. It's just past about 2 years of working in that space, but because of the groundwork and especially the coalition building and the work that she's really done to raise the voices of what families were saying, what VCS was saying, what health workers were saying about the real difficulty of what the families were facing, or even trying to support them. And the way that, trying to raise those voices up, it's now gotten to a spot where there is a pot of funding from central government to specifically support families in temporary accommodation, that we've had the leads of benefits and homelessness prevention and children's advocating for a role that people have said we want it to be like system convening, and we want so that it's in touch with the ground level. We don't want it to just be strategic. We really want it to still be able to hear, learn from, respond to what the experience on the ground has been. And people advocating. This hasn't just been Hannah, it's been other maybe unexpected people in the council saying, and we want VCS partners to be able to guide this work and to be someone that this person in this role would be reporting to and responsible to in terms of what the outcomes are for families. So I see that as like a pretty big shift from where the system was 2 years ago. And I know we can't hang it all on one person's work. It's really been a collective, but it's pretty exciting to see that move. Any other questions or comments, feedback? We're open. Yeah, Emma, come on in.
Do members get invited along to these meetings?
To the Tools for Frontline Staff? We have had members join the odd call. It's been a while since they have.
Yeah, I feel like, and obviously, look, some will be more specific to certain individuals, maybe at certain times, but I feel like that probably should be encouraged. Like, we need that alignment of thinking. And there's, for me, like, the reason to come, like, the main thing is that it's connecting me in with so many different people and parts of the council that I wouldn't even understand those connections without this call taking place. So if as a member, and especially cabinet positions, then that strategic direction around all of this needs to be sort of on the same page, I think.
Just to respond to that, Emma, like Councillor Charlton in particular has been a regular attendee and made herself kind of really useful in the space. But I think we have had others attend over time, but it's certainly something we can do. And as we're looking to renew this space, do that reach out to members again and say, your presence here would be really welcome as part of the system of people trying to make things better for residents in Hackney.
If I could just come back so quickly as well, like they have some levels of engagement that potentially we don't. They have platforms that potentially we don't, to speak in ways we're not able to, that sometimes could maybe, increase our reach.
That's a great shout, Emma. It's definitely on our radar, and as we think about renewing this space. Hey, Natalie.
Hiya. I just wanted to make a comment really and give some feedback, because I have to say, as Charlie mentioned, we did a lot of work together around hoarding support. It was over a year ago, wasn't it?
Yeah.
And I have to say, like, I'm a huge fan of the System Convener program. I think it is one of the most, from my perspective, I'm the director of MRS Independent Living, it is one of the most useful things that has come out of the council in a very long time. We wanted to start some kind of transformation work around improving hoarding support for people in Hackney. And we wanted to bring together, because this is an issue that touches across, lots of different sectors: health, housing, fire services, mental health. We wanted to start a conversation, bringing all of those stakeholders together. And Charlie was so helpful in connecting us with people in the council that we just would not have been able to reach otherwise, as it, you know, as outsiders, not really knowing, you know, very much about how the council is structured, how it works. You know, we just would not have got anywhere with that work without Charlie's help. And so, you know, in the end, we pushed it as far as we could, and then we kind of ran out of money. But we did start a conversation, and we raised the profile of hoarding in a way that we just wouldn't have done otherwise. So I just wanted to champion it really, and just say I think it is a brilliant initiative from Hackney, and I'm glad to hear it's continuing.
Yeah, we're around till March 27, Natalie. So
Yeah.
use us again. I mean, that was also an example of Natalie sent us an email just to say, hey, we've heard about this system convener thing somewhere else. Could we try it here? And, you know, Natalie and Fiona, who runs the Making Room service, who's come to present to this forum before, like they did all the work of like really holding those spaces and making them collaborative. And I do think those were really interesting conversations that we had in those spaces. But it was just one of those examples of like an open offer of like, Natalie said we had this idea, can we try it? And lots of system convening has been around just trying it. So thank you, Ron, for that opportunity. And yeah, another highlight of the work, definitely.
Jahara, do you want to come in?
Yes. Hi, Charles. I just wanted to echo what Natalie has just said. I actually found this space really useful as a social prescriber for family action. And again, you know, connecting with people, just knowing what service is available, who we can refer to support our patients. Yeah, this space has been really useful for us social prescribers, and I know I've had contact with you in terms of the housing side of it, so that's been really useful. Thank you.
Thank you, Jahada. And I guess part of this conversation today isn't just about system convening, it's also about what does this space, the tool session, how can that be useful for people in the next year as it comes into a bit more of our ownership, as it were. So if you've got ideas, Jahada, about what you think who you want to be in this space, how you think it can be useful, even if you want to come and present and give us a day in the life as a social prescriber, that'd be a really helpful thing. Like that's the kind of thing we'd want to be thinking about, of like, how can we make people understand each other better in the system? So
yeah,
if you've got ideas.
So sorry to interrupt you. I think definitely, you know, the choice where you're giving each individual organization coming, presenting about their service offer, because often the VCS organizations, smaller ones, are not heard in the community what they're offering. So this space is really useful.
Are you volunteering for next week or 2 weeks time, Jahada? Is that what I'm hearing?
I'll let you know. I try to attend these as much as I can. You know, I know they're fortnightly, aren't they? Yeah.
Yeah, I'll follow up with you separately.
Sure. Thank you.
Thanks, Jahada. Alex, come on in.
I just want to say, yes, I think it's continuing echoing of a nice positive viewpoint that they've been really useful. I think what we found is, certainly from experience, that new to council and council services over the last couple of years, like joining at the same time as both of you, that it is really complicated. And there's always a department for something hidden away under someone else, under someone else, and under someone else. And having like these sort of things to go, actually, this is the person to go and speak to, you know, or get them here and go, this is their offer, this is how you can help a resident, because we've got this offer within our council gift. But until we know what that gift is, it's unknown unknowns, and I think we're all on this call fighting that, and it's just so helpful that those little gold nuggets that just appear. It might not be every meeting, but you know, every 2 or 3 meetings I attend, there's like, oh, there's a nugget, brilliant, or the emails that come out afterwards, you know, there's a little something just hidden away that you can sort of fire off and share with the team, and that really does affect change we found within the people we're supporting within Hackney Food Bank. So please keep uncovering these nuggets for us, because they definitely go out and meet the residents, and they do get shared. So thank you. Please don't leave us.
And that's just an opportunity as well to shout out Chanel, who's been doing a great work about bringing the Poverty Reduction newsletter together, and kind of is the collator and coordinator of all those nuggets. So we wouldn't be able to do all of that work without Chanel either. So thank you, Chanel.
Absolutely. The gift behind the scenes, huge support, Chanel. and Alex, just even like an opportunity to highlight some of the role that you've been able to play as a proxy for like, what has this relational working meant? So even just recently on a recent newsletter, being able to reach out and say, hang on a second, there might be something with some information being shared here. Can we interrogate that more? Can we make sure that the information we're sharing is the right information for residents? What is that right information? So we really hope that because of the work we're doing, it feels like that's a space that you all can come back to us if there's something that needs that sort of teasing out or improving as well. Which, speaking of, maybe because I'm a bit uncomfortable with the adulation of, of system convening, even though it's been huge work that Charlie and Hannah have been able to do on the ground. Shall we pivot a bit into tool session in that conversation? So first, for those of you who maybe were a little bit later on the call today, I want to apologize for some technical issues we're experiencing with this specific meeting, because it has been going on for 3+ years and we've had so much interest and engagement over those years. The invite list has surpassed 700 people, which is fantastic, unless you're operating on Google Meetings, which does not like meetings to be that big. So really big apologies for those of you who are not Hackney employees, because what we understand is anytime we make any sort of change, like for instance, this week, John handing over the meeting invite to Hannah, what we understand is that triggered a lot of emails to your inbox, and it's apparently a known issue. We can't figure out how to avoid it right now. I'm waiting to hear back from our tech team so that we can resolve it. And it will likely mean getting rid of the current invite and starting fresh, so that you might be able to expect that sort of refresh in some way. We don't know exactly the shape yet of the invite, but we still will hold this space. It'll be one hosted by Charlie and Hannah. And we also wanted to just, Emma, you were sharing kind of what this has been valuable for Jahada, same thing. What do you want to see more of on this call? What do you want to see less of? What ideas might you have? This is really an open floor for how you might imagine tools, the toolbox to shape. Sorry, that was a bad lean into the metaphor. Alex, is that a legacy hand or is that a new hand?
It's a legacy hand, but it can be a new hand as well if you'd like.
Brilliant.
I'll set it up. I think as we go towards we move away from HSF into the resilience funding, like a no-brainer, obviously, over the next coming weeks, months, what that looks like, what doors that opens within the council again is how that funding, what you're doing with that funding and how that's directly with residents, or what that's going towards other VCS organisations, and what offers that are coming on board because of that funding would be really useful. I appreciate that's not a small task, but if it could be like a continual drip feed over the next 12 months, that would, I think, really add value to this tool, because then people can go away with sort of knowing they've got something more to help a resident with.
Yeah, thanks, Alex.
That's the easy one. I'll let someone else come with more complicated now.
Jahada, what do you think?
So for me, as a social prescriber, I think I would like to see more advice providers coming in and presenting, because we are actually struggling in terms of with referrals, could be housing, welfare benefits, just to see other advice organizations come and present here. And a small request, if this meeting could be a little bit earlier in the afternoon.
Yeah.
Thank you.
Thanks, Jahada. With the advice providers coming, would it be helpful to understand like what they offer with specific advice, what good referrals look like, how best to, like what would be really helpful, especially from those sort of presentations?
So I think for us with the social prescribing, it would be more around housing needs, advise on rent arrears as well, rehousing, and then welfare benefits as well.
Yeah. Thank you for sharing that.
You're welcome.
We know housing is an issue that lots of frontline organisations are dealing with all of the time. We have had, some providers over the years come and talk. Helena Stevenson came to talk about tenancy services the session before this. But Jahada, is that something that kind of almost be worth doing regularly? To kind of have that housing touch base, just because we know it's such a huge issue.
So a lot of the community centres, I'm doing my drop-in sessions, and 80% would be for housing needs. Yeah. And it's just a shame that, in my capacity, I'm not able to do that level of support for housing. So we have to signpost. And when we do signpost, there's a long waiting period for, third-party agencies to even take on their referrals.
And is some of that like equipping? So obviously, as a former housing person, this kind of piques my ears. Some of the realities of the housing needs challenge are huge, right? You know this as well as I do.
Mm-hmm.
Is some of that about equipping you with the kind of information that allows you to, give a resident information the first time and trust that be correct? Because sometimes, a resident's need, for example, it's a justified, reasonable need, but the nature of the housing register means they will be waiting for 12 years, just because that's the level of our stock. Would there be a balance of like information sharing versus understanding the referral pathway? What would be the most valuable thing for you?
Yeah, absolutely. I mean, with resources to equip the social prescribers in knowing, what the housing crisis is. I mean, I know myself, I've done my research and I've been to some trainings, but not everybody's equipped to know what the reality is in Hackney with housing, the waiting list and overcrowding and rehousing and all of that. Yeah.
Mm-hmm.
That's really helpful, and we can share some resources that some teams have developed recently that might be helpful. Jahada, just one stat that sticks in my mind, which I hadn't really realized: 85% of the properties that come in the housing register do not have gardens, which is a thing that I know residents often talk about, and it's just a fact that is now stuck in my head, because like you, I've had these conversations over the years and know that lots of residents for really reasonable needs really want a garden. Maybe they might have children with special needs, and it might be someone said that they need a garden. Just to give you an idea of like that level of need, 85% of the properties do not have gardens, and Hackney is one of the most densely populated areas for flats in the country. So that gives you a sense of that kind of stuff. But is that sort of thing helpful?
Yeah, that would be. Thank you.
Fab, we'll look into that for you.
Thank you.
Well, thanks for sharing early thoughts. As we pick this up, this is the first week that we as a team have taken over on the tools sessions. So we really want to be, before making big changes aside from the calendar invite, which we need to sort out, we do want to make sure that we're hearing from different people, so that if we shift the timing, if we decide to format it slightly differently, that's based on what you all and others who attend this session might want to see. So be on the lookout. We'll be looking to make useful changes. If you have ideas, hopefully you know where to reach us. But maybe, Charlie, could you drop our emails in the chat as well? At this point, we usually turn off the recording, so I'm going to just do that. And then if anyone wants to bring up any